is one of the most important issues for Americans, and for many, it is getting more expensive. That's the focus of our new series, Premium Pain, which is all this week on Morning Rush. We're looking into the growing cost of health care and the challenges Americans face when it comes to paying for it. So today we focus on the gig economy, where workers choose when and where to work, often through an app rather than an office. That's on the rise. And more people who make money through those apps, like Lyft, for instance, DoorDash, or Airbnb, are worried quality health care might just be out of reach. National correspondent Katia Tubman joins us now. So, Katia, what kind of challenges did you find these gig workers are facing right now?
Well, good morning, Holly. Whether they're driving someone to the airport, dropping off dinner, or renting out part of their property on an app, gig workers are looking for more control over their income. But that control can feel out of whack when it comes to their health coverage. It's the gig economy, where more and more Americans depend on independent, on-demand work or gigs for their income. And while gig work offers them freedom and flexibility because they do not work directly for a company, they do not get employer-provided health insurance.
Even the same insurance company that I've been with, every year the cost has gone up.
When married couple Elisa and Keith Hazel entered the gig economy as Airbnb hosts several years ago, they went with little to no health coverage, mostly paying out of pocket.
You're not really making any money, so you can't afford it.
Now, parents, the two entrepreneurs, say they need quality health insurance, but they are a part of a growing number of independent or gig workers who don't receive traditional benefits and don't qualify for Medicaid. They rely on government marketplaces and, like millions of Americans, are now experiencing sticker shock. We spoke with Alexa Irish, co-CEO of Catch, an online platform she walked us through that helps independent workers navigate Affordable Care Act marketplaces or their local state exchange.
So this is the Catch website.
The search started with a zip code, age, and gender.
We're going to ask you essentially who's looking for coverage, when are you looking for coverage.
Then we added income.
It's what influences ultimately your premium price and the tax credits that are available to you.
And we looked over our options.
You can filter by insurance carrier, whatever is helpful to you. Our advice to everyone is really to shop early, to look at all your options, and not to stop shopping this year. There's a lot of unknowns this year.
The largest being the future of enhanced tax credits that have made ACA plans affordable for many Americans. Economist and MIT professor Jonathan Gruber.
Health insurance premiums will go up about $1,000 a year for the typical person. That's why so many people will lose their health insurance if these subsidies go away.
Premium Pain, too great for gig workers like the Hazels.
We've made it, a necessity. Like it's imperative. Like we have to have it.
Now, gig work is not going away. That's why health advocates and state leaders are pushing for new models that won't price out gig workers from getting coverage. Holly?
So, Katia, as you mentioned, the gig economy not going away. It's likely here for good. So what does the future of health coverage look like for these workers then?
Well, hopefully some flexibility, Holly. Republican lawmakers have pushed for something that's called portable benefits, and that's where benefits like health insurance are attached to gig workers and not necessarily employers or these app companies. And so this flexibility would create more security for these workers, but also we've heard from experts that it would require modernizing labor laws, something that experts say is desperately needed right now to make sure that these workers are protected. Holly?
National correspondent Katia Tubman, thank you so much.